we would prop that pillow behind the patient's neck, and that just helps them to extend their neck back a little bit. For us nice young patients, we can just ask them to tilt their chin back, and that will help. You see the thyroid? We want to be in our thyroid preset.
Can you annotate?
Yeah, sure. So I'm going to start by going midline on her neck. So we have the right lobe of our thyroid, the left lobe of our thyroid, and then you can follow it up in this band of tissue that connects the two lobes is our isthmus. So we're going to measure our isthmus.
The camera is following you. It's an angle.
So this would be your isthmus measurement. And then you also want to do a color picture, and that's just comparing the blood flow in the two lobes of your thyroid. If a person's thyroid is enlarged and you can't see it all in one image, you can first try your virtual convex. You can also try to do a split screen if that's still not big enough. So you would just use your split screen feature. It'll say L and an R for left and right.
So like if you were doing mine, you'd have to do the split screen because I have a big thyroid, and so it wouldn't fit. Okay.
And when you do this, you still want to make sure that you're trying to match that isthmus up in the middle. That way you're just doing a comparison picture of both lobes. Okay, so that's going to be all of your midline pictures. And then what we're going to do is ask the patient to turn their neck away from us. We're going to just keep the transducer here so that you're looking, you can recognize your thyroid tissues. We have two vessels on the side of our thyroid. The one that's closest to the thyroid is our carotid artery. And then this one that's right next to that, or just lateral to that, is the jugular vein. And then in the midline portion, we have our trachea here. It's filled with air, so that's why it's dark here. So you want to sweep through your thyroid and make sure there's no pathologies that we're missing. It looks like she has a couple little nodules here. You guys see that?
Mm-hmm.
So that's like a little...
What color? It might be vessels. They fell. Oops. Like the one up there, see that's a vessel. So if you get really clear, good pictures, you might see vessels. They're very small. You should put color on.
So like right here, that one is a nodule because it's not filling in with color. Another way that you can tell if it's a nodule or not, if you sweep in and out of it, it will go away and come back. If it's a vessel, like the one up here, you see how as I scan it continues?
Yeah.
Okay, so those are two ways that you can check. You can either put color on it. You should always do both, but you can put color on it, or you can see if it continues. If it doesn't and it just kind of comes in and out, it's usually something that's focal. So we're going to do our midline right thyroid transverse picture and measurement. And this is going to be like the biggest, widest part of your thyroid. You'll see the isthmus coming over. You want to measure from where the border of that carotid artery is to the border of the trachea. You'll put your color on and you'll do a color picture. And then you want to slide up from here, and then you'll do one superior, your second superior, slide all the way out to make sure there's nothing hanging off the edge of your thyroid. And then we're going to come back to your midline where you see that isthmus and the biggest, widest part. From there, we'll come slightly inferior. Your second inferior, and slide all the way out. If you do see nodules, you want to make sure that you're, measuring them. Any pathology that you see, you want to measure. You always want to put color to show if it's vascular or not. and then you would measure it in two planes. So she has a few little nodules. I'm not going to measure all them, but just to show you guys, you know, you would want to make sure that you'd measure them in 2 planes. So that would be our whole transverse protocol. So then we're going to go sagittal on the thyroid. And then you're going to measure. So for her, I did turn the virtual convex on, so it's kind of like pie shaped, just because her thyroid's a little bit longer. So you want to measure from border to border. You guys can see this right here. You see how it's kind of striated? It's a little darker. This is one muscle above your thyroid. So it's kind of easy to see the border here where it meets the thyroid, but down here, it can be a little bit more tricky. You can tell the tissue looks a little bit different. This one's a little more speckly. This has a little bit of striations in it. So you can always just look where you can definitely see it and just kind of follow your thyroid tissue around.
Even if you're going diagonal across it like that?
So I'm just measuring from tip to tip. So
Okay.
right here is the longest tip, and then right here is where it comes out the furthest. Okay. And then you're gonna do your color picture. So after you're done with that, you're gonna angle a little bit lateral for your first lateral picture. A little bit more lateral, and when you come lateral to it, you'll see your carotid artery, okay? So now you're gonna go back mid.
Once you see carotid, you know you're lateral now.
So you're back at mid, so now you're gonna angle slightly medial, just like if you were doing a gallbladder or a kidney or anything like that. You know, you just go back to the widest part, and then you start going the opposite direction, and you know you're medial. So it's your first medial, your second medial, and then you're out of it, now you're in the trachea. So that's your whole protocol, and then you're just gonna do the same thing on the opposite side. So you would just have your patient turn towards you, and then you know, you have your whole transverse, so you would do your mid with measurement, with color. You would do your superiors and then scan all the way out. Come back to your mid. You're gonna go inferior, inferior, all the way out. You would turn to sagittal. You wanna be the longest, widest part. That's gonna be your mid. And then you'll do your laterals all the way out to the carotid. Go back to mid. Do your medials all the way through to the trachea. Survey to make sure there's no nodules. It looks like there's another one right here. So you would just put your color on, make sure it doesn't fill in with color. And then you would, you know, measure, make sure that you measure it in the sagittal plane, and you would measure it in the transverse plane. So your split screen can also be nice if you're, you know, looking at nodules. So you can do your measurements side by side. I'll just show you guys an example. So in your sagittal, so you would do your measurements like that.
Because thyroid is the one gland that, dependent on your protocol, a lot of the hospitals, they literally want you to measure almost everyone that you see. So by doing the split screen, the trans and the sag at the same time, it's, you know, it's less confusing for you when you have to write it down, less confusing for radiologists.
Patty, I think they actually changed the TIRADs.
They did?
Yeah, now you measure in transverse. This is like the only organ that in transverse, if you see something, you're gonna do the 2 measurements in transverse.
Okay.
And then the 1 in sag. They just changed that last year.
Okay.
But you would make sure that you always have 3 measurements so you get a volume of whatever. Okay. And then that's it. That's your whole thyroid protocol. Not too bad, right?